So thank you all so much for joining us for the launch of the Cancer Plus Conversation Series. I'm so excited to be facilitating these webinars as part of my capstone project in the Humane Education MA program. This is offered by the Institute for Humane Education with Antioch University, New England. And I want to give a special thank you to my advisors, Mary Pat Champeau and Chris Tucker, who are here today also. And again, we've gone over some of the housekeeping already, but you can feel free to introduce yourself in the chat for now, but we're going to go ahead and close that once we start the discussion just to minimize distractions. And you can still submit questions for the speakers via the Q&A. We'll get to as many as we can at the end of our time together. So the inspiration for Cancer Plus came after I received a grade 3 brain cancer diagnosis last summer. And I had a lot of emotions and questions and wanted to both connect my studies to what I was experiencing and also connect with other people going through similar challenges. And so I'm really grateful to now have the opportunity to host these dialogues for people touched by cancer or other major health issues. And these panel discussions will span a pretty wide range of topics, but always be grounded in compassion, hope, and inclusivity. So today's inaugural webinar, Cancer Plus Language, Care and Healing Through Storytelling, will spotlight change makers in the field of narrative medicine. So without further ado, I'd like to briefly introduce our panelists. Josh Hauser is an associate professor of medicine and medical education at Northwestern University Feinberg School of Medicine and section chief of palliative care at Jesse Brown VA Medical Center in Chicago. Linda W. Lee is a third-year medical student and Armstrong Humanities Scholar at Duke University School of Medicine, and she is also a co-editor-in-chief of Voices, Duke Med's premier literary journal. Olga Lucia Torres is a lecturer in the narrative medicine program at Columbia University. Olga is also the New York State Advocacy Chairperson for the Lupus Foundation of America and the chair of the Board of Trustees of the Multicultural Media Correspondents Association. So let's get started. I want to start off by asking each of you the same question, letting you share a little bit more about yourselves with this. So Josh, let's start with you. What is your connection to storytelling and medicine?
Elena, thank you. Thank you for having me. Thank you for inviting me. And it's a pleasure to meet Olga and Linda, my co-panelists, and looking forward to hearing a little bit about your work as well. And thanks all of you for being here by Zoom. Elena mentioned that I'm a palliative care physician at Northwestern and at the VA. I started my life as a primary care physician, an internist, and I had this sense as an internist about the importance of meaning and words and language and the interactions we have with patients. And I still remember very specifically 2 patients I got to take care of when I was about Linda's age. I don't know how old Linda is, but about Linda's developmental stage. And I remember some of the images that those patients talked about. One patient talked about being in a boat, and another patient talked about her garden. Those weren't metaphors, those were actually real things. But those made me think a lot about sort of metaphor and story. And as I've kind of moved through the world of palliative care, which I've been doing for the majority of my career, more than 20 years now, I've tried to kind of learn, and I'm still learning, a sensitivity to the metaphors and the words and the stories that patients present to us. And what I found, and this is how I met Elena, I guess a couple months ago, or sort of met virtually on a webinar, what I found is some of the teachings that I've learned from colleagues who are poets and who are English professors and sort of that part of the world have really helped me. So this idea of kind of close reading has a parallel in close listening to patients and their families. So really, happy to get into this as we talk, but I'll end in a moment. But we've done a number of things using poetry as a medium for the appreciation of language and listening and presence with a CE at the end. And with ourselves as healthcare providers, physicians, nurses, social workers, chaplains, et cetera, but also using poetry with patients as a way to promote listening and promote connections. So I'll stop there, Elena, and thank you for the question.
Thank you so much, Josh. Olga, I'd like to offer the same question for you. What is your connection to storytelling in medicine?
Sure. Again, I echo what Josh said. I love the name Joshua, so it's hard not to say Joshua. Josue. So I'm always worried in front of healthcare providers to admit my real profession. I'm an attorney by trade. And after experiencing and surviving a devastating brain injury where it took 6 years to learn how to walk, talk, take care of myself, I had to repair my relationship with healthcare providers because I needed them, right, to recover. But I use stories in my field of law. I was a litigator, so I told stories, painted stories to my jurors, to my judges, to convince them of the way I saw the case, right? So I was really comfortable with telling stories, right? I saw the value proposition in them, and I very much knew that the way we communicated and moved in the world was through telling stories. And then when I found myself immersed in the world of constantly seeing healthcare providers, I sort of had to shift my mindset. And I remember one day saying to my family, I'm a professional patient, right? I went from being a professional attorney and now I'm a professional patient. And what I meant by that was that I had to shift my mindset, and if the healthcare providers came as professionals, I had to come as a professional. And what that meant was I needed to know my medicines, I needed to know my symptoms, I needed to maximize my encounter so that I could have less appointments, like less visits, as opposed to like showing up and not being able to answer the questions, right? And then what that meant was I also needed to narrate my story in an efficient and compelling manner, and also be able to convey what I was feeling about what was happening in a way that wasn't like I wanted, let's say is it Hauser, am I saying that right? To be my BFF, although that would be nice. But just like we needed to create a connection in order for us to move this along and for me to heal, get better, right? And so that's where I found the value of storytelling, just as I was still a patient and recovering, right? And that's when I realized I want to do something in this realm, because I had gone back to being a health care attorney, meaning I was representing people and helping them navigate their denials in terms of their health insurance. But that wasn't satisfying for me, right? I had been a criminal defense attorney. My brain injury made it so that I became very fatigued, and people like to be arrested in the middle of the night. I don't know why. So I went back to school. I got my master's in narrative medicine, and that was the missing piece for me. And then, of course, we use narrative competence. We use everything from art to literature to music to really help not just providers, social workers, but just people to see the value proposition in stories, right? And I had found that piece that was really missing for me, right? And so I use stories now in everything from my work with practitioners to my work with patients, because what I do now is patient advocacy work, but I get to also work with providers at the school, because I teach, and like this weekend we're doing the intensive workshop, and I just love working with the providers, because even though they come interested, they still go, I don't see how I could really listen to the patient's whole story. By the end of the weekend, right, their arms are down here and they get the value proposition of it.
I love that. Thank you so much, Olga, for sharing that about the value of all of the storytelling and your own story with that. Linda, what is your connection to storytelling in medicine?
Yeah, also just wanted to echo what has been said. Thank you so much for inviting me here, especially because I might not have as long of a role in this field as maybe our other panelists do, but yeah, and so like you introduced me before, so I am a medical student right now at Duke. And my connection to storytelling in medicine goes back pretty far, but I think pretty separately first. I think like ever since I was a kid, definitely always loved the power of stories. I distinctly recall going to the library and lugging back like 30 books at a time. But I don't think that the idea of how they could be connected together became clearer to me until I was in college in my last year of undergrad, actually. So by that time, I had already decided that I wanted to become a doctor. I had been applying to schools, medical schools at the time. And I was also a biology major and a creative writing major at the time, but didn't really think about how those two could exactly align. And so I took a class in my senior year of undergrad called Illness Narratives. And so we read so many books in that class. We read Parts of Being Mortal. We read so many short stories by Danielle Ofri, for example, who's a really big powerhouse in the field of narrative medicine, and so many more that really were life-changing for me, in the sense that I could finally realize, the ways that stories can move people, as well as show, the experiences that people with chronic illnesses in particular go through on a day-to-day basis. And so I think that really propelled me to explore further. So definitely read so many books during that semester. And then when I got to Duke for medical school, I decided, this is something that I really want to do, not only for, my future patients and being able to connect to them and be able to share their stories as well, and how they have been so transformative in shaping my life as well as other people's lives. But also, I just really thought that, that this was an incredible part of the field of medicine in general, and just really wanted to encapsulate that into my career. And so Duke has a literary journal called Voices, and you mentioned before that I am one of the co-editors-in-chief, so I have been involved in that capacity. I get to read all these amazing stories, whether that's prose, poetry. We also accept artwork as well, which, stories can also be encapsulated in artwork. And we get to see all these things. We get to just bring the joy of sharing them with the world. So.
That's so great. I love the journal, and it's great to hear all that from you, Linda. Thank you. Okay, so my next question is back to you, Josh. So when I first heard you speak at the Poetry and Medicine event that you mentioned, you identified there the value of listening deeply for metaphors at the bedside. And I know you were just talking about a couple stories where you remember specific references patients were making that were real things in their lives. And I was wondering if you could share with us a little bit more about what that looks like in practice and how that intention of deep listening shapes your connection to your patients.
Thanks, Elena. It's interesting. I guess I reveal my lack of qualification as a poet by when I talk about metaphor, I talk about something real, but I'll just sort of leave that there for a moment. I'm using the term metaphor to stand for things that are metaphors, but also how we take a real event and kind of reinterpret it. So let me sort of give a couple examples that have happened to me and I think are instructive for me at least. So I took care of a veteran for quite a few years, which is unusual because I'm mostly an inpatient doctor, but this was a gentleman who had COPD, chronic obstructive pulmonary disease, and unfortunately bounced back and forth from home to the hospital quite a few times. He was a labor organizer and had an incredible life and taught me a lot about his life. But it was interesting because as a palliative care doctor, I had some trouble talking with him about more serious matters or more weighty matters in his life. And I was like, well, how am I going to talk about this stuff that is really what I often talk about with patients? And then at the end of one of our visits, I said to him, as I say to many patients, I said, nice to see you, Mr. Da-da-da. And he said, well, I'd rather be seen than viewed. I'd rather be seen than viewed, which is a funeral metaphor as far as I can tell. And what I did is I stopped and I kind of smiled, and he smiled because he meant it as a joke. But as Dr. Freud and other people have taught us, behind every joke is something else. And so I asked him, tell me a little bit more about that image. And that allowed us to talk about, the big thing in the corner of the room, which was how ill he was and how fearful he was, and some of the things he wanted to do over these next weeks and months and years. We didn't know what his prognosis was at that moment. So that was, a metaphor supplied by a patient, and how that led to a little bit more of a connection. The other thing, again, this is my lack of qualifications as a poet. I talk a lot to my patients about tattoos. In other words, I ask them about their tattoos, I hope in a respectful, curious way. And when you ask someone about their tattoos, again, I hope in a respectful way, you might hear all sorts of stories. And sometimes those stories will reflect on the present. So I met another veteran in another VA hospital, not here, that I was visiting, who was a World War II veteran, and he had tattoos on his fingers, which is pretty unusual in the World War II era. It's not as unusual in 2023, but it's unusual in the 1940s. And this guy, this is at least 10 years ago, this guy was in his 80s at this point. And his tattoo said, "Born to Stay." BORN on one hand and STAY on another hand. And he got that at the age of 18 in World War II. And born to stay is a very real thing. It's like, I don't want to get killed in World War II, so I'm going to put this tattoo, is what he told me, on my hands, and so are the other men in my unit. But what that allowed me to do is then say, well, how do you think about that now? Because now, as in 10 years ago, as I'm seeing him in palliative care, he's struggling with lung cancer. And what does it mean to be born to stay, or to feel that you're staying on this earth is threatened? So those are a couple examples that come from sort of observation and listening, and, again, metaphors somewhere between true metaphors and a reinterpretation of a real event.
I think those are really powerful stories for sure. And I think tattoos are definitely like a poetic gesture so much of the time. Olga, I want to turn to you next with a question about these patient-provider interactions. And you've already spoken a little bit today about, really maximizing those opportunities for communication. And I was wondering if you could briefly share with us your HEAL model for patients to really make the most of those opportunities to talk with their care team.
Sure. So as I thought about, I knew I had a system, and how could I convey that when I was talking in patient groups and when I went to disability centers. So I came up with an acronym, right? So I thought, what are 4 basic steps that patients could take that will help them have, I called it a more professional, but really it's a more engaged attitude when they see their providers, right? And this attitude will greatly enhance the quality of the interaction with the clinician, and also help patients advocate for themselves. And so it's HEAL, HEAL. So the H stands for honor, right? The patient should honor their and their provider's time by coming prepared. So to their appointments, what can prepared look like? Some of this is, we know that we have a very limited time in the exam room with your provider. Some of that is, I created a medical resume. It's on my website. You can put all of the pertinent health information, like what are your conditions, all of the medicines you take, anything you're allergic to, anything that you think would be helpful. And what I like is when the forms that you have to fill out, which we know are long and lengthy, I often just see attached. I either email it to the receptionist or ask them to print it for me. Some of it could be just doing some research, right? But don't go down the WebMD rabbit hole, right? Just like so you have some language for the provider, and make use of the patient portals, right? Register, you might have taken some lab work, then you have some questions to ask, right? Or if you have access to the exam test results, you can preload, I call, your questions for your provider, right? So that those are some of the things that you could do to just honor your and your provider's time before you come, right? The E is be an expert in your body, right? That's your body. So be an expert in your body, and again, your medical history. What does that look like? I'm wearing this sweater. My daughter couldn't wear this sweater because she'd be sitting here scratching, right? I don't think she's allergic. It just makes her itchy. So you know that. If you're going in for a complaint on your knee, know if it hurts like in the morning, does it hurt at night? Does it hurt when you go up the stairs, down the stairs? Be able to answer some of those very basic questions that you're going to be asked, right? It's your body. Be an expert in it. That doesn't mean go crazy, right? Like, oh my God, what's happening with my body? But just be able to answer some of those basic questions. And this is really important because just 10 years ago, a doctor would interrupt you between like, I'm sorry, I have those stats here. Give me 1 second. You would be interrupted between 12 to 18 seconds. Now it's 11 to 13 seconds, right? So if you're going to be interrupted, have all that information ready to go, right? So that you can say, hey, give me another 10 seconds and I'm going to be able to finish what I'm going to say, right? And so make sure that you have all of this information ready, and you know you're the one, it's your body, so be able to engage in that conversation with your provider. The A is assemble a healthcare support team outside of the hospital. Clinicians have a collaborative team. They check in with a range of professionals about the patient's diagnosis. But what about us as patients? And we should have our own team. Now, should you put family members or friends that are going to be like the sky is falling when you're telling them I have to choose between, like, let's say a chemo or radiation? My mom knew not to put certain family members on her team, right? So you know who to put on your team. Now, ideally, if these people could come with you to an appointment, that'd be great. But we know that isn't always possible. So sit down with these team members before you go to an appointment. Have them help you with questions, concerns before you go into the appointment. And then you check in with them after your appointment, right? And the last one is, listen to your provider and understand what they're actually communicating to you, right? Don't just be polite. Many of us do, right? Yes, ma'am. Yes, sir, right? Actually listen to your provider so that you can then do that whole reflecting back. So this is what I understand you saying, and I'm going to take this medicine for how long, right? So that you really understand the encounter before you leave, as opposed to like having to make another appointment to go back, right? So that's my HEAL acronym.
I appreciate that so much, Olga. As I think I told you before, I wish I had that when I first started my treatment, and I think of it now when I go to my appointment. So thank you. Linda, I want to turn back to you next. So we've talked thus far about narrative and language as being powerful elements in the clinical encounters, but of course, we've also touched on how narrative can be helpful for processing those encounters later. And you, as a co-editor for Voices, you get to hear all people's stories from different points in these medical experiences. So I'm curious, in that experience, what themes you've noticed in the submissions that you've received from across the medical community.
Yeah, thank you for asking. So I guess for a little bit of context, so Voices, our literary journal, receive submissions from not only doctors, students in training, but also other members of the healthcare team, so PA, nurses, PTs, so many more, as well as patients. So really it's open to anyone in the community. And so what I've noticed is that, oftentimes we are using, or a lot of the submissions are more like reflective writing, in the sense that it is a story, a piece that is written in order to reflect on an experience. And a lot of the time, I think we receive a lot of submissions about providers who are grappling with very difficult concepts, like the idea of death or end of life care, themes like those. I think my suspicion for why that is just because, in medicine, particularly if you work in a setting like a big hospital, you're oftentimes surrounded by death, unfortunately. And that's a very unique experience to medicine in comparison to a lot of other professions. And so I think a lot of people struggle with figuring out how to honor that, but also, continuing with their jobs and balancing that being able to protect themselves and not, let their emotions get a hold of themselves, while also still honoring the patients who are passing, or the families of those patients. And so I think that's one thing that has come up a lot. Other themes include the concept of burnout, or moral injury as well, where a lot of, especially during the pandemic, especially with just how often providers were working and feeling just overwhelmed by all that was happening within the healthcare system. I think burnout has been an especially common theme that we've seen, as well as people also, or a lot of writers also talk about just systemic issues. And so we'll talk about, there's a poem from I think the last issue that we released that is about sort of the healthcare as a business, and how the healthcare industry has cropped up and isn't necessarily the best advocates for patients. So we talk about a lot of those things. And for patients who submit their art or writing, I think it's oftentimes about their experiences with chronic illness, and maybe encounters that they've had with providers. There is another poem that I recall about a patient who learned that she had Takotsubo cardiomyopathy, which is often called broken heart syndrome. Very interesting, but essentially the theory is that it's like you have a heart attack, but it's stress induced. But for her, it was just it was a hard diagnosis to wrap her head around, especially as she had to go through all of the tests as well that come with it. And so, yeah, so I think we see a really wide range of submissions with all of those themes in mind. We also see people or patients, as well as providers, who talk a lot about their intersectionality of culture, or their sex, their gender with medicine as well. And so we have had discussions, essays written about things such as abortion, since that's been a particularly important issue nationally. And so, yeah, we just receive so many submissions that all are incredible, of course, and I think really delve deeper into some of the things that we as healthcare providers don't get to delve as deeply into on a day-to-day basis.
Thank you so much, Linda. That's really interesting to hear about the huge swath of experiences that you hear about through those submissions. And one theme that I feel like translates into our next question that you brought up is when people are just coping with the unknown. And Josh, I'd like to turn this next question to you. I'm sure this is very familiar topic in palliative care as it is in oncology of patients and their doctors and their loved ones needing to just cope with uncertainty. And I'm curious about how you found that poetry and those narrative exercises support patients in navigating those kind of in-between states and dealing with the unknown that comes with being in treatment.
Thank you for such a simple question, Elena. So I tend to deal with my anxiety with humor, in case you guys didn't realize that. I think this sort of coping with uncertainty is one of the cardinal challenges of being a patient. And all of us on this call are patients in certain ways, and that includes me. And it's also one of the challenges of being a physician. So I don't want to misrepresent myself by saying I know how to deal with it, because I don't. I hope I know how to think about it and help facilitate sort of being in that space. And I actually think that's the first point, is that as a physician, as a nurse, as a social worker, as a chaplain, as anyone taking care of a patient, we need to resist the temptation to say there is no uncertainty. We know this, this, and this. Now, of course, there are things we have more certainty about, and we should be mindful of those and clear about those. But in terms of, as we think about what the future holds with this diagnosis and this condition and this experience, there's a lot of uncertainty that is endemic to that. So just acknowledging that and being plain about that and sitting in that space with people is sort of the first step, or a first step. The second thing is, so much of reading, and so much specifically of reading poetry, is about, things that might mean this or might mean that. And it's ambiguous and it's not clear. And those are words on a page as opposed to illness in a body. But through looking at words on a page in that way, maybe that'll reflect back to how I'm thinking about my illness experience. And sort of that's kind of what I've found as we've talked about poems with patients. As I mentioned, we have been working, I didn't mention this part, we work with the Poetry Foundation, which is here in Chicago. It's the publisher of Poetry Magazine, an amazing place that, again, has taught me a lot. And we've been working with them, and we've developed a few different groups of poems that we use with patients, mostly at the VA. I mentioned I spent time at the VA and at Northwestern. And we have poems that are about nature. We have poems that are about the city of Chicago and other cities. And we have poems about health and illness. And that brings me to my last point, which is that when you ask patients, do you want to read a poem about health and illness or the city or nature? No one wants to read a poem about health and illness. Which of course makes a lot of sense, and we should have realized that. But I think that that's another version of how people, cope with uncertainty. Maybe means putting their mind somewhere else. And as we read a poem together, and as we talk about a poem together, what will happen inevitably is there'll be associations of, this poem about nature, about my growing up, about my family, about my whatever. And sometimes it will come back to illness, but sometimes it won't. Sometimes it'll just be a different space for the mind, the patient's mind, the doctor's mind to be in for those few minutes. I didn't mean to dismiss your question by joking about it at the beginning, because I think it's a really deep question and an important one. And I think the main ways we help patients with uncertainty is, number one, acknowledging it. Number two, being present for it and opening up a space for it. And number three, maybe you're offering a poem or a story or a way of talking that might help them think about it.
Gosh, I like that a lot about the ambiguity. And I think you're right too, that it's interesting to hear that people just normally gravitate away from the illness themed poems, because sometimes you do need to step away and just be in a different headspace for sure. And Linda, I'm going to ask you the next question. How has reading all of the stories that you've described, or seeing if they're artwork too, how has receiving all of that shaped how you approach your studies and your work in medicine as you are an MD candidate and prepare for like that next chapter in your career journey?
Yeah, I think reading is inherently is a way of putting yourself into someone else's shoes, right? So I think that's part of the reason why we love stories so much, is that we get to transport ourselves into another world, even if it is a world that might be similar to ours, but transport ourselves into another world and think from another person's perspective. And so really, storytelling and reading other people's stories do an amazing job of just developing empathy. I think that's like the grounds on which a lot of medical education has been trying to convince the leaders of medicine to incorporate narrative medicine into medical education. And they say, you know, this develops empathic doctors or empathetic doctors. And, you know, I think that my answer is probably a little bit simple in that sense. And like you would think, well, of course, like doctors should be empathetic. Something I've learned though is that, you know, even though a lot of my classmates, for example, all come in thinking, you know, we come into medicine, we come into healthcare in general wanting to help people. But what I found is that oftentimes the system doesn't make that the easiest, where, you know, we get boggled down with all the work that we have to do. And it makes it very easy for us to not care as much about our patients. Unfortunately, that's just really the reality of it all. And I think that some of the stories that we've already been sharing, you know, show that there are, you know, those challenges that people across the country have experienced. And so I think that incorporating narrative medicine into my life, the medical humanities in general into my life, has helped me focus on that throughout my career, throughout my training, because it's so easy to get lost otherwise. And, you know, you have to do all of this research, you have to do all of these other extracurricular things in order to get to the next part of your career. And so being able to center myself with reading, with writing, through art, all of those things has been so incredibly helpful. And just remembering why I went into medicine to begin with, and, you know, what the kind of doctor that I want to be to my patients, a doctor who really listens to their stories and values what they have to say. So.
That's awesome. Thank you, Linda. I think that's a really great observation about it, like narrative medicine being sort of an antidote to like compassion fatigue or something like that. Okay, Olga, you have the last but not least question. So as someone who's shared your own medical experiences through personal writing, and now you're teaching narrative medicine, what advice would you give to people with cancer or other serious diagnoses who are seeking some kind of expressive outlet to process, but they're not sure where to begin?
Sure. Again, I echoed Josh. No easy question. I want to piggyback on Josh's question. I almost bumped Linda because I just wanted to answer. You know, what narrative medicine does, right? It takes the reading of the poems. And again, we don't use health or illness poems for that very reason, because if we're working with healthcare providers, they want to diagnose the poem, right? If it's a poem that has anything health related or a patient type of character, they're going to diagnose it, right? And then we can't get them back to focus to the writing, right? So we use poems about anything else, even images that looks like there might be a patient. We're like, don't look at the patient. But after reading the poems, we then write in the shadow of that text, right? We have a writing prompt, right? And this is where the creativity part really comes in. We want to hone in those narrative competence skills, but we do the same thing with people that are not providers, right? So let's say the patients, right? And so my first thing would say, come to our free virtual session. I know that the chat is disabled, but I don't know if I could put it in the Q&A. I'll put the link there. Let's see, let me copy and I'll put it here.
Enable the chat too, so that way you can.
Oh, I
throw
can't
right
put it in the
there.
chat? Perfect.
Yeah,
Let
we
me
can
put it in
change
there.
that.
Perfect. I'll put it here. All right. And so we have free sessions in multiple languages. I used to do both English and Spanish, but with teaching and all of my other commitments, I only facilitate the ones in Spanish. But so you can come and they are free and you get a real taste of what narrative medicine is like. You'll be able to get your creative writing juices going. Also, you don't have to write, right? People can draw, people do like, it sounds very much like the Voices journal. But of course you only have a couple minutes to do whatever creativity you want. But so I encourage people to just whatever you're moved to do, to please do it, because it's so important to get that out, to get that expression, that creative expression out. My mother was very remiss to write. My mother went through 2 stem cell transplants before she died of cancer, but she would sew, crochet. She just did it had to come out of her fingers in some way, shape, or form. What's so great is, I mean, this was just as the internet was starting. There's so many outlets out there. You just Google it. There's resources that you can partake in that are free of charge. Most of them are free of charge. But through Columbia, we are happy to partner with people, happy to bring and work with bringing narrative medicine to different schools, places where you are. So please, if it comes to you wanting to do narrative medicine, we are still offering it for free because the pandemic isn't over. I'm so afraid when I see people like post-pandemic party, and I'm like, where's the post-pandemic? So yeah, in terms when it comes to narrative medicine, we are happy to do it with you, to show you how it's done so that you can, and also, we're also happy to show you where you can get free poems, artwork. NYU has an amazing free library of resources, and we go there and take their stuff. We're so happy to get access to artwork and poems that are, and of course, the Poetry Foundation is fantastic in terms of, so that you can read stuff, be inspired, and create your own material.
Awesome. Thank you for sharing all those resources, Olga. I appreciate it. So now we've gotten through all the prepared section of this event in terms of my questions for you all. So we want to make sure that we open it up to questions from our audience via the Q&A. I see that it looks like we already have one question waiting, and I have a few that were submitted ahead of time as well. So we'll go ahead and get started. And then also Olga, Linda, and Josh, if you all have any other comments that you want to share too, just feel free to take this opportunity to open up with any of those other thoughts or points that you want to make that we didn't get to earlier. So our first question is from Nicole, and she asked if it would be possible to clarify the differences between narrative medicine and narrative therapy. Would anybody like to offer a response to Nicole on that point?
I'm happy to give it a try. So narrative therapy is a form of psychotherapy that uses narratives, like people using their narratives, as far as I understand, as a form of treatment, if you will. Narrative medicine is where we use, where we try to get, where we train both practitioners, social workers, therapists, etc., to teach them the concept of narrative competence so that they could better hear, interpret, be moved by patients' stories of illness, and to basically help the encounter between patients and these providers in the space of healthcare. And so they're similar in that we're using narratives, but they're different in that therapy is therapy in terms of narrative therapy, right? But they're still using this idea of stories and narrative. I'm sorry if I didn't do that justice, but anybody else that wants to chime in, please do.
That was great. That was a very comprehensive answer. Thank you. Another participant has asked us about good forums for live storytelling about patient experiences. And I would also expand this question to just ask if you all have read or listened to anything recently that you'd recommend to this audience.
What an interesting question. Gosh, it's making me think, and maybe Linda and Olga are thinking too. For me, these experiences are very focused on my sort of life as a physician. And in other words, they're stories and they're experiences that happen between me and patients and families, and then happen between me and students and colleagues and others. And so they're sort of confined to that space, which ultimately is a pretty private space, right? It's a space between patients and healthcare professionals. I do think it's a really interesting question as sort of what are kind of more public spaces that this may happen in. I would only say that there are events that the Poetry Foundation, for example, puts on that aren't about narrative medicine, but are about sort of the appreciation of poetry in the world. And those are things that I enjoy, and I bet others enjoy. The other thing that this makes me think about is one of, some of my role models in medicine in terms of storytelling are people who have nothing to do with medicine. So in other words, someone like Ira Glass, who hosts This American Life, or someone like Terry Gross, who hosts Fresh Air. And I mentioned kind of examples like that because those are humans in the world who are really good at helping bring out stories. So that to me is like a public version of what I do with people who want to do that in public. And so I learn a lot from those kinds of stories. I guess the last thing I'll say, which is kind of a shameless promotion, not for me, but for a dear colleague and friend whom I've known since I was a medical student. She's a psychiatrist and she just retired this show, but had for more than 15 years a show called Safe Space Radio, SAFE Space Radio. And that was on the NPR affiliate in Maine, the state of Maine, and was all about difficult things that patients experience. And a difficult thing might be the stigma of mental illness, and a difficult thing might be trauma, and a difficult thing might be the experience of homelessness, et cetera, et cetera, et cetera. And her goal was to have kind of like this question is making me think, a very public forum for those difficult experiences. So Anne is my friend's name, Anne Hallward, and Safe Space Radio is her project, and it's an amazing project.
And some of the, like Bellevue is having a contest through their literary journal where you could propose a story that you want to tell to the public, and they'll pair you with their people and help you curate your story. So all you have to do is like submit a 5-minute proposal of what your story is. But there's some literary journals that will allow you to tell your story aloud. So you can just sort of Google, like, of course they have a lot of slams, right, where you can tell your story. So I've done a couple of those, and I'm like, I'm an attorney, I got this. And the minute you get on that stage, I'm like, JK, LOL, I want to go home. I just need a jury. I don't need like a whole theater of people. Just give me 12 people, and somehow that was less nerve-wracking. So I think you just have to do a little bit of research on that end. But yeah, I love the suggestions that Josh said. But I was really liked that the journals are pairing, so if you don't want to write it down, you could say it out loud, and then there's an audience of people that come to listen. It seems really nice, intimate way to do it. So I think it's just an issue of looking up some of those journals that are want to listen to personal stories. And in terms of a book, something that was really moving and personal to me, I lost my father to Alzheimer's, was In Love by Amy Bloom. She lost her husband to Alzheimer's. He made the choice to go to Switzerland and end his life. And my father asked for that, and we were like, we're not going to do that. But he just went, like, we were talking to him, and then he went to his room, and then he died. And so it was to me, very, it was a hard book to read, but very beautifully written. And it's about a choice, right? You don't have to agree with it, but it was quite beautiful memoir, and talked about the love between that couple.
Yeah, I think, I don't know if I have much more to echo. Definitely also agree in terms of ways of sharing your story are through the literary journals that we've discussed. I, unashamed plug, would always welcome submissions to Voices, but Bellevue, the BLR, is a very good other literary journal as well. There are plenty of others. And maybe I should drop a link to Voices in the chat. Or if I send it to you, Elena, maybe you can send it out to everyone else. But yeah, and so definitely welcome those. And then there are also a lot of live storytelling events, like in the Triangle area in North Carolina. We have our own special live storytelling, like the story slams that people were discussing before, called the Monty here. And I've heard amazing stories from those kinds of shows as well, where, for example, someone who was a mother shared how the story of how her son had been, or her daughter had been, in a coma before, and unfortunately passed, but the story of how she was coping with other people reacting to the miracle of someone whose son had woken up from the coma. So talking about those kinds of experiences are also just really powerful. Yeah, and in terms of something that I've read recently that I thought was amazing, A History of Present Illness by Anna DeForest is incredible. I think it came out last year. It is actually a fictional book. So Anna DeForest is a neurologist and palliative care physician in New York, and her work, the book, is actually a work of fiction, which is really interesting because you find that oftentimes when you're in spaces like this, these are typically very personal nonfiction narratives. But I find it just incredible that she's still able to portray such a very authentic voice, because it is based off a lot of the events in her life, and really brings about, really discusses concepts of trauma, but also burnout and moral injury, all with, like, being a doctor in the healthcare system, as well as someone who needs care themselves. So it's an amazing book, would highly recommend.
Well, so much. That was so many great recommendations, and I feel like there's still been some more contributions also from our audience in the chat. So I'll make sure that all of these are compiled and available on the Cancer Plus website afterward too, so everyone can go back if they didn't get a chance to scribble everything down or copy paste things out of the Zoom meeting. I have one more, at least one more question to ask before we wrap up. I see we're getting close to time, and I want to be respectful of everybody's other commitments. Participant asked, do you also encourage family members of the patient to process their own emotions, such as sadness and uncertainty, through storytelling?
The short answer is yes, and you know, I think it's clear that you know, patients go through illness in the context of a family, however defined, and there may be there are lots of divergent feelings that families and patients may have. There may be feelings of anger, of love, of everything in between. And I think it is important to kind of think about how we honor that range of feelings, and because some of those feelings might not be so sort of culturally acceptable, that maybe I'm a little frustrated with my fill in the blank, wife, husband, partner, son, brother, daughter, at the same time that I love them and I'm feeling so sad. So I think that I've been thinking a lot about this in sort of our work with poetry, that sometimes when the patient is asleep, I'll read a poem with a family member and different things will come up. And I'm not quite sure what to do with that other than to sort of open that space up. But I think it's a really important context to think about, because I like to say as a physician, it's like they're with the patient the other 23 hours and 40 minutes. I'm there for 20 minutes and the family's there for 23 hours and 40 minutes, et cetera, et cetera. So thank you for that. It's an important group to honor.
Yes, absolutely. And provide a space for them to read, whatever, we poem, a piece of art or whatever we bring, and to write, right? And then journal. And if finances allow, we'd like to bring little journal books so that where we write, right, to after we have done a poem, a piece of art, and then they can keep those books so that they can continue writing in those journals. So they have a space to write, to vent. I've had patients that, the whiteboard where they put today the nurses, and they've just erased that and have written there, just vented or drawn, and it's funny because then the doctors have come in and been like, and it's nice when the doctors just leave it and honor it, or the nurses leave it and honor it, right? Or add to it, right? And that's been really nice to witness when they've done that. They've just taken it over. And I'm like, at some point you got to leave that there for the providers. But today was a really hard day and you needed to put your emotions there, and this narrative medicine, the bejesus out of that. But I bought you this notebook, so let's use the notebook in case the nurse or the doctor needs to write something there. But yeah, I say 100% yes, of course, yeah.
That's great. Thank you all so much. Well, I see we are at time, so I do want to give a big thank you to all of our panelists, Josh, Olga, Linda. It's been such a pleasure having you all. I see lots of clapping in our little Zoom boxes. I know it's hard to see with all of our faces being so big, but I also want to give a big thank you to all of our attendees. We are so grateful that you logged on today to share in this discussion and conversation with us. Like I said before, we'll share any questions that we didn't get to answer live with the panelists afterward, and I'll post those responses on the Cancer Plus website and let everybody know via email about that. And you can join us next month for our upcoming panel, which is Cancer Plus Vocation, where we're going to discuss how to navigate work and identity and aspirations in the wake of a serious diagnosis. So once again, I want to thank you all so much for your time, and I hope you all have a great rest of your day. Thank you. Take care, everybody.
Thank you. Take care.
All so much. Thanks, Olga.
Bye. Oh, my
Bye-bye.
pleasure.
Thank
Bye-bye.
you. Thanks, everybody. Bye-bye.